Thank you for joining us today for UCA's COVID-19 webinar series. This one is for all practice managers, communication and digital strategies in a COVID-19 world. We are lucky to have longtime UCA convention contributor Chris Behan of Socius Marketing presenting this important information today. First, a little about Chris. As an internet marketing expert who has helped hundreds of companies build and enhance their web presence, Chris Behan knows how to make companies stand out for their competitors online. He is the founder and president of Socius Marketing, one of the largest internet marketing firms in the country, which has produced over 1 million leads through powerful patient acquisitions programs. Drawing on more than 20 years of unparalleled research and search engine optimization and internet marketing experience, Chris provides practical advice on how healthcare companies can increase traffic to their websites with high-ranking original content that speaks to a potential patient's precise needs. So before we get started, here are just a few housekeeping announcements. First of all, if you have any questions, please go ahead and type those into the question box in your dashboard, and then we'll come back on at the end and ask those to Chris as much as we can within the hour. And then also the webinar is being recorded and you will receive a copy in your email tomorrow. So I'm going to go ahead and turn this over to Chris. Thank you.
Thank you so much for the introduction, and I certainly appreciate everyone's time today. I'll take you through some information that, we're employing for a lot of the urgent cares and system health networks that we're currently working with. Know that everything that we're going to share with you has already been tested and tried and true through this process. So we're going to really focus very heavily on things that we understand work. Okay, so I'll kind of jump into this, very quickly here. I'm not going to spend too much time on my bio. She kind of, covered that for us already. But, know that we're coming from a place of experience. So we want to help everybody through this process. We want everyone to really understand the information. So certainly don't forget to chat us some questions throughout this, and we'll do our very best at the end there to answer those questions. So from a learning objective standpoint today, what we want to talk about is how do you drive more volume into what we call owned assets, meaning things that you own as an organization using Google search and social media. How do you effectively communicate across platform? How do you make your message consistent is really what we're talking about there. And then how do we convert more users into patients via online bookings and telehealth, kind of what everybody is talking about at this point. So how do we effectively get that messaging out in front of people? So we'll break all of these things down through the course of this webinar, and I'll do my best to kind of elaborate where we really need to have a greater understanding. So the first thing is what channels should you be marketing in right now? And certainly the mix has changed. The very heavily marketed avenues right now are search, social media. TV is seeing a very large explosion with advertising currently. Certainly that'll begin to balance itself out as we get closer to the election cycle. YouTube, and then direct mail. So people are at home really more than they have been ever in the past, ever in modern history. So when you look at where to market, know that those are really what's driving the bulk of interest at this point. Things like radio, where most people listen to the radio in their car, on the way to work, on the way back from work, billboards, outdoor advertising, transit, those things have taken a little bit of a back seat as of late because of the quarantine. We're just not out consuming that type of information, that type of advertising the way that we did in the past. So what's interesting is that, I live in a very data-driven world, okay? And we can pull aggregate data, just basically blanket from the web, and we can see how whole categories of businesses are performing. What's interesting is healthcare as a category is actually down a little bit. It's down close to 7%. Things like home services are down 20%, legal 12%, auto 25%. The average that we're seeing, across everything is about 20% down across the board, with an interesting exception. And certainly this obviously, gets us into the crisis that we're currently in. But urgent care specifically, we're up almost 9%, a little over 8.5%, where elective and all of these other things saw some pretty drastic drops. So, this is certainly a time for urgent care to shine, to be very forward in the messaging, and to really stand out among other categories of business, and then even within kind of your own business categories as well. There's a lift that's currently happening in the urgent care space. One great tool that's out there is something called Google Trends, and this is just something that anyone could go to. You go to Google, type in trends, and it will take you to this tool. And what it shows you is what's trending in Google right now. And obviously, it's no big secret that testing is obviously the biggest thing happening right now. People want to know, how do I get tested? Where do I go? And that keyword search is coming in from, as you would expect, from really the core of where a lot of this crisis is happening. But it's all over the United States at this point. It's the kind of the pivotal point of where people are searching is they're taking it out there and they're starting with testing. This same, tool called Trends will show me a different term called COVID testing near me. So we've seen an explosion in near me search, where people are out, researching nationally, and then they drill down to that near me kind of component, and then they begin to consume information from there. You see essentially it not even registering in Google in the beginning of March. So a giant spike, right around March 17th or so, and then it kind of evened out a little bit, but it's still a very, very large volume of search that's happening for COVID testing near me. It's a big pusher into what Google is really looking at, and they've taken some pretty unique steps, which I'll share with you in this process, to make sure the results that they feel are relevant are coming up first. Breaking that down even further, what's interesting is that same tool is we look at related topics and rising, and the first two things here have nothing to do with COVID. There's actually an electronic company that is unfortunately named that always had a lot of volume going to it. We're not sure what number two is, but the number one thing that's connected to this, again, is urgent cares. Okay, not hospitals, not doctors' offices. People are trying to find out, do urgent cares test for these types of things? So when we click on that, it breaks it out even further, and it shows us exactly what people are searching. So, what I tell people about search is that what's interesting is it's actually a little bit of a stream of consciousness that's coming from people. This is exactly what they're searching and the areas that they're searching it, and it's directly connected to urgent cares. So near me, testing near me, COVID-19 testing near me. Near me is a big, big part of this search query that we're seeing. So through all of this, urgent care is certainly at the forefront from the testing perspective. The question becomes is how do we begin to capture volume like this, and how do we get the right messaging out, because we certainly don't want droves of people just showing up at our locations, and we'll talk about those things. But you do have to modify your campaigns and your copy. You do have to adjust your landing page strategies. SEO, that search engine optimization, the process that you put a website through to get it to rank highly in search on the free side. You have to look at your approach to all of this. How do you advertise? There's just so many questions that are out there right now as to what works and what doesn't work, because we need to be careful with how we spend our marketing dollars right now, and we're making sure that we're pulling in the right patients, and we're being careful with the people that we do see. So I'll take you through some of what people are doing right now to begin to address some of these questions. Let's first talk about modifying your ad campaigns online, okay? We have to go through and make sure that we're adapting to the current situation. And if you don't adapt your ads, you're going to be pulling in an awful lot of people that you may or may not be able to help. So if we kind of look at this from a conversion funnel standpoint, you have these like very top of funnel keywords, okay, which are still very, very highly searched, but they're very top of funnel, and there's tons of it happening right now. You probably don't want to be in the very top of funnel right now, unless you're a very, very large outfit with tons of locations. You might not want to be there. You probably don't want to be ranking on my ankle swollen and school physicals and lab services and things like this. It's just too top of funnel right now. Where you begin to get to where you want to be is in this kind of second layer. And these are all keywords that, kind of fall into that second layer for us. Flu treatment, cold, flu shot providers, tests for the flu vaccine. You'll notice, and I'll get to it, that COVID is purposely missing from these keywords, and we'll talk about why here in a minute. But know that this is the basic conversion model. Then when you really want to drill down to it, and to me, this is where at a minimum everybody needs to be at right now. You still need to be in that very bottom of funnel, and there's more of it now than there ever has been in the past. So bottom of funnel is urgent care near me. I know walk-in clinic is a little bit of a dated term, but it still gets used very, very consistently. Virtual doctor's appointments. I mean, this was something that as an industry, everyone was talking about. And I know that some system health was doing it, and I know that telehealth has become a thing over the last few years. But it went from a group of people doing it to just about everybody offering this at this point. And I think what we have to understand is that this is going to create a little bit of a shift, well into the future. I mean, to me, this will begin to get a little bit better here week by week. I think most areas will see improvements. But you're going to have an entire group of people that are very comfortable with virtual visits at this point, and especially after this. So know that this isn't just the right now kind of thing. It's into the future kind of thing as well. And then, brand. Make sure you are buying the name of your company or the name of your clinic. Do not let other people buy it and kind of take your position in there. No matter what you do, you always want to be buying the keywords that are related to your brand. That's the absolute bottom of the funnel. Now, I mentioned, before that we were, kind of purposely missing the COVID keywords right here. Google will not allow you to do pay-per-click on that specific keyword or on COVID-related keywords. They took a pretty hard stance on it and said, look, we're only going to promote CDC information. We're going to let, the organic listings, these are listings right here, rank where they may. So if you optimize for COVID-related keywords, which you all should be, you can still rank on that near me or that geo-modified search. But buying the keyword is not really an option at this point. You have to make sure that you're ranking organically if you're looking for it. Now, I'll give you other ways of going after this market here in a minute, but buying that specific keyword is just off the table from Google's perspective. From modifying your campaign and your keywords and your ad copy. So these are little snapshots of what ads look like on cell phones. For you, it's 75% of all of your traffic is on a cell phone. Most of your conversions will happen on a cell phone, so that's kind of why we're showing this example. The first thing that you have to say is that, hey, we're open. And you can get a virtual visit online, and you can schedule this thing online. You have to kind of keep reinforcing that information. So I know that when you look at this, and this is an example of Physicians One, it's Physician One urgent care, virtual visits available, great care without leaving the home. It's almost like that old adage of tell them what you're going to tell them, and then tell them again, because they only read half of what you put up there. And people, for the most part, only understand half of that. So using your titles up here effectively is very important. And then reiterate this on here. Virtual visit hours, 8 a.m. to 8 p.m. Friday, Friday and 9 a.m. to 5 p.m. Saturday and Sunday. You've got to make sure that your ad copy is more clear than it really has ever been, any time before this. Because again, people are looking for virtual visits, and an amazing amount of these are being run at this point. From a conversion standpoint, what's interesting is that, we have a report that basically shows us how conversion rates plummet during certain times. So it's not that people are searching less from 12 a.m. to 6, 7 a.m. They're searching just as much. But what we're seeing is a loss of conversion during those late night hours. They might just have a common cold, but it's weighing heavily on them. They're Googling things, but they're not converting. So anyone that is running pay-per-click currently that is a little bit limited by budget or doesn't have an unlimited budget like most of us, you want to make sure that you're running during the core hours, which is really about 7 to 5, 7 a.m. to about 5 p.m. You're still getting good traffic, but there's not that big drop in the conversion rate that's associated with late night hour searching. So what you see here is as the further this goes down, the lower the conversion rate goes. So if you're doing it in-house, if you're working with an agency and you think that you might be limited by budget, okay, Google will tell you that. I can tell you if you want a generality, if you're spending $1,000 a month right now, you're probably limited by budget. So you want to get with them and say, look, what I want to do is some dayparting is what this is called. And I want to run during the times of the day that, not just has the good traffic, but has the best conversion rates. So be very, very mindful of this process right now, because there's so much search happening at some of these later hours, but not that much conversion going on. So if you, again, are limited by budget, focus in kind of your core business hours. That's when most conversions are happening. You want to modify all of your campaigns, and you want to increase your display advertising, believe it or not. And look, I've been doing this for 25 years, and I don't get to say increase your display advertising all that often. Because what display advertising is, are those banners or buttons that appear all over the web through Google's display program, but people don't click on them all that much, or at least sometimes when they click on them, they didn't mean to click on it. They're mouse readers and they accidentally clicked on it. But what we've seen is this: Google search in general for every business category. And I'm not specifically speaking to urgent care, because we know that you guys are a little bit of exception, but overall, it's down about 20%. People shopping in Google's down about 15%. Bing search is down about 5%. The reason that one's not as big a loss is because they have nowhere near the amount of traffic, and most of the time Bing users are up in Montana and places like that, but they're a little bit less affected. Search Partners is only down 4%. But what's interesting is Google display advertising is actually seeing more engagement. It's actually up 13%. So consider doing display advertising, and I'll show you what that looks like here in a minute as well. And YouTube. So, again, YouTube is a video-based advertising platform that is seeing tremendous increases. And this is just an example of us all being home and us all being on our devices and then consuming information a little bit differently than we had in years past. So really begin to look at this information and consider a display campaign at this point. And here's an example of what you could or should be advertising. Now, I mentioned earlier that you can't outright, run COVID advertising. Google will not allow it. Bing will not allow it at this point. But, these are display advertising banners that are working, and people do read between the lines and understand that, hey, maybe I do want to get screened for this. So get your symptoms screened, book a virtual appointment today, book now. Same messaging, but, get evaluated, book a virtual appointment today. Consider banner advertising if you're looking to drive up this type of volume. But just, again, stay away from COVID-related keywords, because if you don't, Google will actually block you from ever running. If you're not checking in your interface all that often, you might not even see that your ads are actually running. So just keep your terminology a little bit more generic, if you will. The other part that's interesting is that when you're running display and you're running virtual appointments, and that's what this is really about, virtual appointments, telehealth, it's not just about the specific geo that you're currently operating in. So I know as urgent cares, we feel like we have a 20, 25-mile range maybe of people that will drive in and see us. When you're running virtual and telehealth and you're looking to see more people, we would encourage you to expand that radius drastically. They don't have to come in to talk to you. So begin to open that up a little bit. The other part is it doesn't take as long to get places, since most of us have some type of quarantine that we're going through. You can cover more ground more quickly and consider opening up that radius, again, specifically to telehealth and things like that. As we, come down through this process, know that right now everything is abbreviated, okay? The conversion process is completely abbreviated. 3 months ago, 2 months ago, people would be like, well, I'm going to go and I'm going to look at this urgent care. And is it close enough to me? I got to see that. What does traffic look like? What is their staff? Do they have everything that I'm looking for? You have people, converting much more quickly. The average time for conversion previously was about 2 minutes. And we see that it's roughly half of that right now. So if you're doing a lot of advertising, consider landing them on pages, that get you right to the virtual visits page if that's something that you're doing, or right to the online check-in page if that's something that you're doing. But one big thing, you even have to be careful with talking about COVID on your website, okay? There is a definite sensitivity to that, and we'll talk a little bit more about that here in a minute as well. But know that if you're buying those types of keywords and you're running display and the page that you land them on talks about COVID too much, Google will actually disapprove your ads for that as well. So you have to be a little bit careful through that process. And we'll talk about ways that you should consider modifying your website to kind of convey these things as well in a minute. You know, from an organic perspective, which is that free side of search where you can go after COVID-related keywords, you know, these are things that you want to be talking about. We need to talk about your map pack as well. So, you know, your map pack, you know, essentially that map listings that get people to your location. It's called GMB by Google officially, Google My Business. They changed how you operate that map when this thing started happening, okay? So if you Google your name in a location, you'll see your map pack show up, or your map listing, or again, your Google My Business account. And then there's a COVID update that you'll see right in here. And Google will allow you to create a post, okay? So you can go in here and update your business hours. If you have some offices that are not operating, they will allow you to tell people that they're not operating. If there's a change in regular services, so like, look, we're no longer doing this, so we can focus on this, you can communicate it right in here as well. Additionally, we believe you can communicate the fact that you offer that testing in this location. So this is definitely something that you want to be updating through this process. You know, make sure that you go through and you're working every single avenue you possibly can, because this is something that really stands out. When people search your name, it's this map listing that shows up for people. So make sure that it's 100% current and it's completely up to date. You know, from a content standpoint, you do want to create content that's specific to the outbreak, okay? And you want to have kind of a hub within your website. So imagine just going to your website and having a link to 8 or 9, 10, 12 pages that are kind of article style related to the COVID crisis. You want to begin to position yourself, you know, over the long term for something like this. So like this is an example from Dispatch Health, you know, what to do if you get sick while in self-isolation, 5 ways to protect seniors from COVID-19. Begin to think about the content opportunities that are associated with this, because people are consuming this content at an incredibly high rate right now. Now, I'm to be clear, I'm not the guy that thinks that this is going to continue for months and months and months or 8 months down the road. And I know that some people will say, do I want to create content for this? Well, this is going to be part of what we deal with probably for at least 12 months. You know, hopefully nowhere near the degree that's happening right now. But this content is a bit more evergreen than you would think it would be, okay? So, I mean, I encourage everyone to really go out and begin to develop content for your website. You know, in that content hub, you know, you want to be talking about symptoms and warning signs and risk factor pages, you know, things to know by age group. I mean, get a little creative with, you know, what people are searching for. I'll give you a tip here in a minute as well. Statistics, how to cope with isolation and mental health, you know, keeping active in quarantine. There's so many ideas that are out there right now from a content perspective that will drive a lot of free traffic to your website over the next 12 months. That, you know, it's a great time to be sharing really good information with your community. You know, one way to get these topics is this. And, you know, we pulled this one kind of by a virtual doctor telehealth kind of thing. But a lot of you have probably seen this People Also Ask box show up in Google search engines. I mean, it's there pretty much all of the time at this point. Actually started in healthcare and then rolled out into other verticals. You know, this box is what is called PAA, or People Also Ask, and it's part of the rank brain algorithm that Google is operating. And what Google is giving you is they're taking all of the search in through spoken search, through in-home automation devices, through search through your cell phone, and they're basically organizing it for you. So if you're thinking about telehealth or virtual visits, know that when you do a search in Google, if you typed in telehealth in Google, this box is going to pop up along with all the results. and know that this is a direct insight into what people are thinking. How much does it cost? What does this even mean? Can I get a doctor's note from a virtual visit? Is United Healthcare offer this? What do they treat? Will they prescribe Xanax? You're getting this stream of consciousness. And what's interesting is that for the marketers on this call, they're not really keywords at this point. It's not just urgent care Schaumburg, Illinois, or urgent care Dallas, Texas. This is spoken search directly into Google. So when you are looking for topics and things to write content on for your website or on virtual or telehealth, conduct a search and then look at what ranks. I mean, they're ranking it for a reason. Google ranked it because they find it super relevant to the topics that are happening. So when you look at this, just go out and create a page. Can I get a doctor's note from a virtual visit? Well, let me write some content about that. And that content, especially around telehealth and virtual, is not going anywhere. This is great content to be ahead of. From a shareable standpoint, what you also want to be creating are content that you think could get shared out by other organizations. I mean, anytime you create content, have the user in mind. You might want to go out and repurpose some of your blog content or your news or your press releases. Content is kind of difficult to write for some people. So know that you probably have content all over your website now in a lot of cases that you can go through and adjust and repurpose and republish that content and then make it shareable for other people through social media channels. So, let's talk a little bit about social media here. Right now we are consuming social media in a way that has never been consumed before. I mean, everybody's sitting at home, they're sitting on their couches, their devices are in hand, and this is what people are spending their time on in so many cases. I don't know if that's good or bad. It's probably a little bit of both. But know that, there is an opportunity to get good messaging out there, helpful messaging that will get, to let people know that you are a resource to the community. So let's just kind of quickly talk about some best practices as it relates to this. So know that you need to be consistent throughout this entire thing. And this is not new. This is, marketing 101, consistency in your messaging. But you want to make sure that you're consistent from platform to platform to platform, okay? It is about repetition. It is about making sure that people recognize the brand and ultimately will increase the amount of conversions that you're getting. So when you look at this, you see a Google ad off to the left here. It's position 1, urgent care, virtual visits, and without leaving the home. Their Facebook posts. Position 1, urgent care, now offering virtual visits without leaving the home. And then carry that through, into your website call to action. So this is a big mistake that healthcare makes in general. They will go to market, whether it's Facebook or Google or TV or whatever the medium might actually be. And the things that they talk about in their posts don't match their website in a very deliberate way. So if I saw this post on Facebook and I clicked on it and I went to the website and the button on your website just says contact us, or it's not really, really clear, how do I get a virtual visit? Then they're going to disengage. They're going to completely disconnect from, that entire process. So make sure that you stay on top of this. When in this example, from a Facebook post to here, we go right into 2 buttons. Now available, access the care you need without even leaving your home. Again, consistent across all forms. Even the colors, learn more or check in online. Make it very, very easy right now to convert through this process. A little bit less storytelling about your organization and a little bit more deliberate conversion. From just another update standpoint, updates are really good coming through Twitter and through Facebook. So, you want to be active right now on all of your social media channels. You want to be, conveying people, hey, we're open. We offer this service or that service, or these are the conditions of our offices. And I'll give you examples of that here in a minute. But make sure that you're constantly communicating with people, over-communicate. Also know that from an organic post standpoint, when you post on Facebook, it's less than 3% of the people will ever see your post, okay? And in a lot of cases, they might not ever see your post. So even if they went out, and in this case, they liked or fanned or whatever we want to call it now, MD Now Urgent Care, they went out and said, I want information from these people in the past, know that Facebook doesn't publish it to everybody. So you might want to consider promoting your posts. Put a little bit of budget behind it. And when I say a little bit, $20 is not a bad budget for promoting a few posts. Okay, that will get your reach way, way up. So if you've thought to yourself, I'm doing this and it doesn't work, know that it's probably falling on deaf ears. Most people are not seeing it unless you're putting a little bit of budget behind it. You know, from a strategy standpoint, maximize your exposure. I mean, so here's Instagram, and you can engage with posts and stories and live interactions. You know, be a little bit creative when you possibly can. Communicate to people. I mean, there are instances where, you know, people think organizations are completely overwhelmed, and sometimes they are. There are more often than not, you're not overwhelmed, and you are seeing new people. But people need the assurance that it is safe to come in and that you are open, or you have telemedicine to help through that initial consultation. Communicate, 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 and don't be agnostic to one social media platform. Let's just say just Facebook. Hit all of them you possibly can. All the ones that you have set up, you want to continue to work more aggressively right now. You know, from how you communicate, you've got to be adjusting your website as well. And there's some core messaging that you want to make sure is out there. And the tone of this section it's obvious. You have to be incredibly obvious with how you're communicating with people right now. The first thing that I'll show you, use an example of Fast Track Urgent Care, which is I believe it's part of Tampa General Hospital, is you need what's called a bug me bar at the top of your website, okay? It's a little red bar, whatever color you would like, but it basically tells you, it sits on the top of every single page, and it gives the very pertinent information, okay? And in this case, since it's a system health thing, they elected to go with, referring to CDC Checker to help you find the information you're looking for. But that bug me bar is very important. Know that, you have the option of closing the bug me bar if you want to. You click on that and it goes away. But there's where you communicate. Are you open? Are you not open? How are you handling COVID? Are you complying with CDC regulations? People are expecting this. I can tell you, as an organization, we have installed hundreds and hundreds of bug me bars at the tops of websites, and they work incredibly well. You want to be communicating through this bug me bar. The next thing to really, look at is what does it say behind the bug me bar? So I'm going to back up one slide. So when you click on these things right here, it needs to take you to somewhere. So when you click on that, in this case, there's just general information about their operation. We're taking every step to keep you safe. We're sanitizing every surface. Or if anyone presents to cough, they're asked to put on a mask. You've got to tell this story effectively, and it's got to live at the top of every single page. If you have it on one page in your website right now, the likelihood of a user finding that is pretty small. They're going to move on very quickly to somewhere else. So use that bar to communicate and reassure people that you're doing what you should be doing through this process. Make sure that you have a page on your website that communicates that and breaks it down. Cleanliness, availability, location information, hours of operation. Are you offering limited services? I mean, the last thing you want to do is bring somebody in there and you hit, oh, I'm sorry, we're not doing that right now because of this. Be very careful, with things like that. Do you offer curbside check-in? Do you offer online check-in? How many patients are you allowing into your facility at one time? This is what people are looking for. We see it in all of our advertising right now. People are very careful with where they travel to, especially in these more affected areas. Also, below the bug me bar, in a lot of cases, or wherever you can get it, really communicate your hours of operation. This is a staple no matter what's happening. The biggest thing is I need your phone. Are you open? I need your phone number. I need directions to get there. That's standard for, years and years now. it's just reinforced a little bit heavier right now. So when you look at it, it's pretty clear. Serving Hillsborough, Pasco, and Pinellas County, open 7 days a week, 8 to 8. Pay online, which we'll talk about, phone numbers, log in. It's all right there at the top of the page. Again, abbreviating that conversion process right now as much as you possibly can. You know, if you are a testing center, you have got to make it very, very prominent, okay? You know, in this case, COVID testing is available, open every day. COVID testing, book a virtual visit. It's got to be transparent. It can't just be like one link at the top of the page that gets you in there. You know, and then make sure that you have a page that backs it up and then tells these people what to do. So in this case, if you think you have it, if you have COVID, schedule a virtual visit first. During that visit, we're going to determine if a test is needed. Okay, so take them from here to here quickly. Because what you don't want is, yep, they do it, and then they just get in their car and they show up when that's not the protocol that you may or may not have set up. So make sure that, again, you're very, very clear through that process. You know, if you're doing virtual visits or flat fees or, you know, talking about insurance, you know, again, make sure that it's really, really obvious, okay? You know, we're now offering virtual visits. You know, in this case, they were $99, but, you know, they're trying to help out, you know, present this information for a $59 virtual visit. I mean, the big push in the urgent care world has definitely been to get into this virtual space. But now that we all have to shift so quickly to promote it effectively and let people know that we have that. I mean, if you think back to, you know, 8 or 9 slides ago, or that people also ask section, I believe it was the third question. The third most commonly asked question is, what is a virtual visit? They don't even know. So we have to educate and we have to tell them how this process works through this process. So just be really, really mindful through this. You know, so, you know, to talk about conversion strategies and being obvious, let's just pull up this example here again. We run all types of analytics on our clients' websites. We can literally track where people's mouse click on here. It's called mouse flow, and we can watch them navigate websites. I can tell you, you would all be shocked to realize that people don't see things that are right in front of them. So repetition right now, in our opinion, is very important. So, you know, from a virtual visit appointment standpoint, you know, we say it here, we say it here, we say it here. You know, it's repetition. You know, we've kind of got to drill it into them that this is a thing. You know, another example of that is just, this one's a bit cleaner, you know, check in online. If you're doing online check-ins, make sure that you're talking about those things as well. Consider landing people a little bit more on location pages than you had in the past. So if you're doing pay-per-click, make sure that, you know, your agency you're working with, or if you're doing it internally, you know, do some tests on landing people right on location pages opposed to the home page. And again, that's just an effort to move people through this process in a more efficient manner. And again, that's what they're looking for. You know, also know this. I'm showing you desktop right now. It's 75% of the people in the urgent care space never use their desktop. And things that work on your laptop and on your desktop computer will not work properly on a cell phone. So 75% of people are coming in on a cell phone. I would say after this, everyone that's on the call, and there's a lot of you on the call, load your website on your cell phone. If you're someone you're quarantining with has a different cell phone and you have an Apple and they have an Android, load it on theirs, because it changes from device to device. Make sure the buttons still work. Make sure your messaging is still there. Make sure I can get directions quickly to your location. Make sure the phone number is prominent. Make sure it's clickable. Double check everything on your cell phone. It is a very, very common problem to take a really good looking, high functioning desktop website, load it on a cell phone, and then realize, boy, I've got a major, major problem going on with how my website operates on a cell phone. You know, one thing to also look at, we've kind of pointed out this little chat button right here as well. We're seeing an increased engagement with chat. So if you've been thinking about chat and you do not have it now, I would encourage you to go ahead and get it. If you have it now, make sure that it's being monitored very, very effectively through this process. MedNow is one. This is Bird Eye, Podium. There's a lot of good chat functionality that's out there, and a lot of people don't want to talk. So this is a great way to capture more information and ultimately help more people through this process, which is obviously what this is really all about. So if you haven't done chat, I really, really would consider it. I mean, online payment processing, I think, is a big, big thing as well. Especially if you're doing virtual, you probably would like to collect some type of payment that's associated with that. So if you're not doing online bill pay, you want to try to transition as quickly as you can to accepting online payments. It's the expectation at this point. It's really necessary to be successful online. So, to begin to wrap it up, I'll just kind of cover this last slide, and if we have any questions on the next slide, we can take them. You want to make these adjustments now. And this says, this is a new reality. I'm a little bit over the new reality, as most of you probably are, because I don't believe that it's permanent. I do think we'll see positive change out of this as well. But we need to make these adjustments now. Okay, and this isn't well, it'll be over in my area probably in a month, and do I want to do this? We know that we'll be living with this to some extent, way less than we are now, for 6, 7, 8, 9 months. So make these adjustments now. Don't be afraid to roll these things out, and don't think it has to be perfect. Okay, you do not want to be in that paralysis by analysis mode. It is not going to be perfect to be effective. It doesn't have to be perfect to be effective. It just has to be up. Get started on it, begin to roll it out, and you'll figure out what bumps you hit in the road that are unique to your organization, and you'll make those adjustments kind of on the fly, like we all have in the last 3 or 4 weeks. Try new strategies. If your agency brings you an idea and it sounds like a good idea, then jump in and do it. Right now, again, there's never been more search specific to what you guys do. And new strategies are going to be important because we're just consuming information in a way that we had never consumed information before. And just maintain the core messaging. I mean, I have spent so much time with so many of you, and I know the passion that you have for your communities. I know how you serve your patients, and it's inspiring. Talk about that. Build it into your messaging. I mean, this is, everyone's chance to really shine through something like this. And, we're excited that you guys let us share this messaging with you and the things that are working. I think at this point, if there are any questions, that come through, we'd be happy to take them.
Thanks, Chris. Gosh, you shared a ton of good information. I think everybody will walk away with something that they can implement. So far we have a couple questions. And if anybody else has other ones, please go ahead and type those in now. First question is, exactly where and how are you running these display ads on Google? These look like display ads you pay for on a website.
So, Google will do that work for you. So in Google's ads interface, it used to be called Google AdWords, and they abbreviated it down. You can actually set up display advertising in Google's interface, and Google will go out and they will place the advertising for you. So you utilize Google's network, which is huge. I mean, we're talking about hundreds and hundreds of millions, if not billions of web pages. And they will place that advertising for you. Also in that interface, though, what you can do is you can make decisions to not advertise in certain places. So you might say, I don't really want to advertise there. I'll turn that off, or I'll turn this on. But it's very easy, and it's right in Google's ads interface.
All right, great. Okay, next question. We have patients going to our website, then we couple our message with our exterior signage to tell our patients how we want them to behave before they actually walk through our doors. How do you recommend we amplify all of our channels or make them work better together?
Consistency is the key in that. I mean, if you're having that type of signage outside of the urgent care, I think that's fantastic. And that, for me, that's something that would resonate with me, that you take it that seriously. So, I mean, I don't know what that signage looks like, but that could become part of your advertising. So make sure that from your ads to your landing page to your Facebook post to everything that you're doing, there's that consistent messaging built into it. And maybe if that signage is really good and you're at that level, maybe that becomes part of the advertising. But it's something like that, just pull every ad format you have across every channel, put them in like a Word document and see how well do they match up. And then make sure that wherever you're landing them, the call to action matches the landing page experience as well. But it sounds like you're doing a great job with that.
All right, next question. Have you seen a difference in search trends between urban and rural areas?
We have. It's actually a little bit higher on the urban side of things. So you're seeing that a greater increase on the urban side, but across the board in every area, and there's actually a slide in the very beginning that showed that, there's an increase in every single state in the country right now. So it's every state is seeing that increase in search volume. It is a little bit heavier in more affected areas, and unfortunately, those more affected areas tend to be a bit more urban.
And then just a follow up to that, are you seeing campaign performance, differentiate or a difference between campaign performance between urban and rural?
Not really. So the conversion rates are pretty consistent. It's not necessarily urban and rural. It's more of affected area. So you do see a little bit higher conversion rates in affected areas.
Okay, great. All right, well, we'll give one more minute if anybody has any other questions that we just for Chris. Okay, one more came in. What would be some effective videos to post? You mentioned YouTube is an effective tool for people searching.
It is. So, I mean, YouTube is the second largest search engine behind Google. So it's way ahead of Bing and things like that. I think right now, community-based messaging is really where it's at. But I do think there's room for you to get your service messaging in there. So I think, and it doesn't have to be super high, production quality. I think you could even shoot things with your cell phone, as long as the messaging is on board, that we're here to help, we're open, we're a testing facility. Stick to the core, keep it very short and digestible. In my opinion, 15-second clips are great. 30-second is good, and much past that, you're probably going to begin to lose engagement. So look at those 15 to 30-second formats. Keep it community-based and core messaging.
All right. Well, that looks like it's all the questions we have. I think you did a really complete job of covering the topic. Again, I'd like to thank Chris Bean and Associates Marketing and all of you for attending today. Thanks so much. There's a quick evaluation when you're closing out. If you'd please take that, we would appreciate it.
Thank you.
Thanks.